Sago, my name's Kyla Thompson. I'm a first-year midwifery student with the Ungwahuma Midwives. Today I'm just going to be going over the respiratory system diagram. So the organs of the respiratory system include the nose, the pharynx, the larynx, the trachea, the bronchi and the smaller branches, the lungs, and the alveoli. Gas exchange within the blood only happens in the alveoli, and the other organs are passageways that allow the air to reach the lungs. So the nose is the only externally visible part of the respiratory system. Hair and mucus lining the nasal cavity help to trap dust and other debris in the air before they can reach the inside of the body. Air enters the nose by passing through the nostrils. The interior of the nose consists of the nasal cavity divided by a midline nasal septum. The receptors for the sense of smell are found in the mucosa in the slit-like superior part of the nasal cavity, and the rest of the nasal cavity cavity's mucosa is respiratory mucosa, which warms the air as it flows past. The mucus also traps incoming bacteria and other debris. Lysosome enzymes in the mucus destroy bacteria chemically, and the ciliated cells of the nasal mucosa move the sheet of contaminated mucus back towards the throat to be spit out or swallowed and digested by stomach juices. When we're cold, the cilia become sluggish, resulting in a runny nose. The walls of the nasal cavity are uneven and covered in 3 mucus-covered lobes called conchi, which increase the surface area of mucosa exposed to the air and also increases air turbulence in the nasal cavity. The nasal cavity is separated from the oral cavity by the palate, which is right here. The part of the palate that is supported by bone is the hard palate, and where it is unsupported is the soft palate. The nasal cavity is surrounded by paranasal sinuses in the frontal, sphenoid, ethmoid, and maxillary bones. The sinuses lighten the skull and act as a resonance chamber for speech, and also produce mucus that drains the nasal cavity. Nose blowing also helps to drain the nasal cavity. So the pharynx, commonly called the throat, here, serves as a passageway for food. Air entering the superior portion of the nasal pharynx through the nasal cavity travels down through the oral pharynx and the laryngeal pharynx and enters the larynx. Food enters the mouth, travels with air through the oral pharynx and the laryngeal pharynx, but instead of going to the larynx, it's pushed aside to go down the esophagus. So the larynx is also known as the voice box. It directs food and air into the proper channels and plays a role in speech. It is formed by 8 rigid hyaline cartilages and a spoon-shaped flap of elastic cartilage called the epiglottis. The largest hyaline cartilage is the shield-shaped thyroid cartilage, commonly called the Adam's apple. The epiglottis protects the opening into the larynx. When we swallow food or fluids, the larynx is pulled upwards and the epiglottis tips, forming a lid over the larynx, directing food into the esophagus. If anything other than air enters the larynx, a cough reflex is triggered to get the substance out and prevent it from going into the lungs. The vocal folds are formed by a pair of folds in the larynx that vibrate with expelled air. The ability of the vocal folds to vibrate allows us to speak. The slit-like passage between the folds is the glottis. So the trachea, which is also known as the windpipe, the rigid shape of the trachea is because its walls are reinforced with C-shaped hyaline rings. The opening of the rings allows the epiglottis to expand when we swallow a large piece of food, and the solid portions of the trachea walls keep it open in spite of the pressure changes with breathing. The trachea is lined with ciliated mucosa. The cilia beat continuously and propel mucus loaded with dust particles and other debris away from the lungs to be spat out or swallowed. Air entering the trachea from the larynx travels down its length of about 4 centimeters to the mid-chest and branches off into the left and right bronchi. So the bronchi are formed by the division of the trachea. By the time incoming air reaches the bronchi, it is warm and cleansed of most impurities and is humidified. The smaller subdivisions of the bronchi in the lungs are direct routes to the air sacs. So the lungs are the large organs that occupy the entire thoracic cavity, except for the mediastinum, which houses the heart, blood vessels, and other organs. The apex is the narrow top portion of the lung that rests, and the base is the broad area of the lung that rests on the diaphragm. Each lung is divided into lobes by fissures. The left lung has 2 lobes and the right lung has 3. I'm not sure exactly where. The surface of each lung is covered with visceral serosa, called the pulmonary or visceral pleura. The walls of the thoracic cavity are lined by parietal pleura. The pleural membranes produce pleural fluid, which allows the lungs to glide over the thoracic wall during breathing. So the bronchioles are the terminal branches that lead into the respiratory zone structures that eventually terminate into alveoles. The alveoli make up the bulk of the lung. After entering the lungs, the main bronchi branch off into smaller branches, ending in the smallest conducting passageway of the bronchioles, which is right here. The alveoli are grape-like bunches. They make up the bulk of both lungs. And the respiratory zone is the only site of gas exchange. It consists of the alveoli, alveolar sacs, alveolar ducts, and the respiratory bronchioles. The other respiratory passages are conducting zone structures that serve as conduits to and from the respiratory zone.